Dr. Zhitnitsky, everybody's afraid of radiation, not only because we had the Japanese, atomic thing blowing up, but in the medical field, and everything has gone towards lower radiation when you take an X-ray, including dentistry. Now, tell us, is it important to kind of go to a dentist who has more new equipment and has lower radiation equipment, or is it really not that big of a deal in the first place?
Well, in the old days, we used to have very, very slow film that used to take a lot of radiation to expose, but that's the only thing that we had. And with progress, with new technology, it's gotten faster, and the dose of radiation has gotten lower and lower. And now what we actually have digital X-rays, which are only at most 20% of the radiation of the old film. So you can take 5 new X-rays with the same radiation as the old one picture.
Right.
And it's much clearer when you put it on the computer screen. There's much less chance of you losing it, like the old film may drop somewhere. It's digitally protected. And it's a very good advancement as far as diagnostic quality. We have gone
because
a long way.
You see better, right? So if the X-ray is better, you less likely to miss a cavity or a crack in the tooth or something like that, right?
Absolutely. We use digital X-rays. We use a digital intraoral camera that lights up the mouth that we can actually take pictures of and actually see if there's a cavity or a filling that needs replacement, just because we can blow it up on the computer screen and see it more than life size. It's sort of a magnification that computers help us with. Wow. And X-rays are the same way. In the old days, an old X-ray is about this big, or I can have a tooth that I could see which is this big. Obviously, I'll be able to see much more in the larger picture.
Mm-hmm. The digital X-rays tell us, relatively uncomfortable to take than those bite wings. We have to bite on it, and it's not the end of the world, but it's a little bit uncomfortable. The digital X-ray easier to take, easier on the patient?
Well, the sensor is a little bit bigger than an X-ray, so it's not much different.
Okay.
But what happens is that the benefits of it are so much greater that I would never ever go back to using old film again.
Right. Okay. So every little bit helps, I guess, to then prevent the big boom.
Oh, absolutely, absolutely. The less radiation we get in our lifetime, because it accumulates.
Right.
Once you get radiated, it always stays with you, so less is definitely better.
Right. And if you then find things faster, that's what it is all about, be it in cancer treatment or whatever, finding it as fast as possible, you have more chance of curing it, period, end of discussion. And especially in dentistry, because out of all the branches of dentistry, everything, from the stomach to the lung to just a plain cold, a headache, the nose, eyes, name it, dentistry is the most preventable and has the most secure, predictable outcome from any branches of medicine, is what I heard. And would you agree with that?
Oh, absolutely, absolutely. If we catch something early enough, it's much easier to cure than if you let things go. Absolutely. And new diagnostic X-rays, digital X-rays, and intraoral cameras, and we even have special equipment that tests your nerves of your teeth to see if they're vital or you need root canals. It helps a lot, and it's a really great service to our patients.
Well, I remember my dentist when I was about 8 or 9 years old. And I sat there, and my dad was with me, and my dentist was also my MD, by the way. And he turned his mirror around, with that big metal stick, and he poked on every one of my tooth. And the one I jumped, he says, this one is bad. So you don't do this anymore? You don't do this sophisticated?
No, we don't. We're infinitely more sophisticated than that nowadays.
I personally, and by the way, I'm not kidding. I'm really, really not kidding. But on this particular incident, and God bless the guy. He was, he treated our whole family, and back in those days, he would come with snow and storm at 12 o'clock at night when I was sick, or mom or whoever, right? But the fact is, on that day, he was wrong. I said, it's not that tooth. And he says, it is. And I said, no, it isn't. And my father, he just, he gave me the backhand. He flopped me one. And then about 5 hours later, after the injection went away again, my tooth was hurting again. And Daddy really excused himself and brought me back, and they fixed the right one. So glad to hear that we have a more sophisticated diagnosis. Thank you very much.
Yes, much better than tapping.
Much better than tapping. I think he broke more teeth than he found the right ones by doing that.